Hi, my name is Alex Goltray, and I'm going to be talking about bioethics, principles of ethics, and I'm really going to primarily focus on four different topics here: beneficence, non-maleficence, autonomy, and justice. So to really start out, we'll talk about the principles of beneficence and non-maleficence. So as far as beneficence goes, it is essentially a way of being good because it is performing an action that will benefit other people. As stated in chapter 3 of our textbook, um, the the principle of beneficence says no more than do good, and these moral actions are generally based off of empathy and kindness. And you do not perform a kind act because you gain value from it. You perform the act to help others in need. Many times, people who are practicing beneficence are trying to protect an individual from impairment and help them out as best as they can. And the principle stated in chapter 3 for non maleficence states to avoid evil. Both of the principles stay in the chapter to be very generalized, which makes it really difficult to kind of interpret it because it's easy to see that there would be a lot of limitations. As an example, you would see a child drowning in an ice cold river. You want to save the child, which has no benefit for you, so that'll be beneficence. But you realize that attempting this rescue would put you at high risk for death, and the child would drown in both situations, and that's evil. This complexity happens in healthcare pretty much every single day. Clinicians spend years training on disease processes, pharmaceuticals, procedures, and more to help patients live a better, longer, and healthier life. And however, patients have autonomy in regards to the care that they receive, and clinicians must never overrule a patient's autonomy. They can only provide objective, thorough, and detailed information to the patient in regards to treatment, and the patient must decide what path they want to take. So, also stated in the chapter, it says, our obligation to do good is also limited by our obligation to do evil, the basis for the distinction between ordinary and extraordinary care, where ordinary care might help the patient, but the odds are poor or the risk and burdens are very high. In other words, the medical benefits we provide as clinicians should really offset the medical burdens for the patient. Clinicians must be patient advocated and educate their patients, but they must also avoid the evil and respect the wishes of their patients. I personally have severely suffered with this in the past. As an example, I have lost a few pediatric trauma patients solely due to the fact that their family were Jehovah's Witnesses. I'm not trying to disrespect any kind of religious practices or faiths, but I am coming from a clinical standpoint, and these patients have suffered severe blood loss during some kind of motor vehicle accident. In order for us to save their lives, they needed immediate blood transfusions. But because the family was Jehovah's Witnesses, they did not provide the consent, and they absolutely refused a blood transfusion. And as a result, the patient unfortunately suffered mortality. Um, the medical team did what we were supposed to do. We educated the family on what was going on with their child and what medical interventions were needed to save their life. We clearly stated to them that if their child does not receive the transfusion, that they will die. The family received all the objective information we provided to them, and they decided not to go through with the transfusion, and we respected the autonomy and wishes of the family. As I had mentioned before, I do not want to disrespect anyone's beliefs or practices, but as patient advocate, those few cases were very difficult for me emotionally and mentally. But this is just one type of complex battle we deal with on a daily basis working in healthcare. And all we can do is really continue to try to do our best and help those individuals in need and work within our guidelines. Um, Now, as far as autonomy goes, um, so this kind of goes back to chapter 2 of our textbook, and it really starts off by discussing, um, having respect towards individual people, and having respect for people is giving them their dignity and allowing them to make their own life choices in particular societal situations. In other words, we're giving each person their own autonomy. As stated in chapter 2, one human person as precisely a human person does not have authority and should not have power over another person. In other words, people cannot or should not dictate what other people should be doing. Everyone must respect the privacy and freedom of every individual and may only make decisions for another person when it is absolutely needed to protect that individual. And there are many different aspects of autonomy, but one in particular that I personally deal with on a daily basis is informed consent and patient autonomy. Um, in the chapter 2, it also states, "You shall not treat a patient without the informed consent of the patient or his or her lawful surrogate, except in narrowly defined emergencies." And really, all that statement is saying is to give respect and freedom to each individual patient in regards to the care that they will be receiving or lack thereof. It prevents any tyranny from the medical personnel and enhances decision making from the patient themselves because at the end of the day, they have to live with the outcomes and consequences of the medical therapies, treatments, or procedures that are performed on them. In order for us to provide care, we must acquire an informed consent from the patient or a designated family member. There's obviously some exceptions like emergencies, but and informed consents can be very complex but fairly straightforward. The patient's or designated decision maker needs to be in a decision making capacity and coherent and competent, and the physician must explain thorough, detailed information regarding the diagnosis and the treatment. If one of those are absent, then there's no patient consent and care must not be provided. Explanation of medical care must entail the following: procedure, possible side effects, prognosis with and without treatment, outcome percentages, economic costs, any alternative treatments or therapies, social costs, emergency exceptions, and psychic costs of the procedure. This topic can be very complex, intriguing, and difficult all at the same time. Even though it may seem fairly straightforward, I personally decided to do a little bit of research on my own in regards to the principle of autonomy and informed consent. And I found a very heartbreaking case study. This particular case study had happened in Texas. And to kind of summarize this case as quickly as possible, the husband found his wife lifeless at the house when he came home from work. The wife was 14 weeks pregnant. So, according to the hospital, they believe that she suffered from pulmonary embolism, which resulted in severe brain death that was irreversible. The husband wanted to withdraw care, but because his wife was in a vegetative state, and it is what she would have wanted. However, the Texas hospital denied his request to withdraw care because, citing Texas Health and Safety Code 166.049, this law states a person may not withdraw or withhold life sustaining treatment under this subchapter from a pregnant patient. This provision supersedes any personal directive and or wish from a pregnant patient. The husband ultimately filed suit in the Texas state court, and the judge agreed that the law in Texas did not apply to patients who are already deceased. However, I did a little more digging onto this topic, and I found out that Kansas is slightly different because they make it very clear that even if a woman has filed a declaration to medical personnel to withhold life sustaining procedures, her wishes do not matter if she's pregnant. Until the legislator clarifies KSA 6528103, or the courts are forced to arbitrate like the court in Texas, there's no clear cut answer of what effect, if any, brain death has on the law, which requires artificially sustaining the body of a legally deceased pregnant woman. To the defense of the hospital and the law, they were wanting to protect the life of the unborn child. Some states have pregnancy clauses or pregnancy exclusions, so there are advanced directives statutes to disallow the application of a woman's advance directive when she is pregnant. And really, what it comes down to is, should a pregnant woman who is legally and medically dead be forced to be kept on life support and act as a vessel for the sake of a non viable fetus? Arguably, I would personally say no. I don't believe if someone is 9 weeks pregnant that it is ethical, in my opinion, to keep this individual in a vegetative state alive for the remainder of the pregnancy. Some of the questions and concerns that I personally would have coming from a clinical standpoint are: did the fetus suffer any damage or cessation of blood flow during the incident? Will the drugs that are used to keep the mother alive have a dramatic effect on the fetus and the neurologic status when they are born, such as developmentally delayed, cerebral palsy, so on and so forth? And are there laws and clauses that have a cutoff on gestational age? Because 14 weeks pregnant is not very far into the entire pregnancy time frame. And I don't believe that there is a really correct answer for this tragic incident. And I believe every situation will really have to be evaluated extensively from all parties: the family, the healthcare team, and the legislature. Um, as far as now justice goes, um, here's a little. I want to read some texts from Plato's Rings of Gyges of the Book of the Two Republic. So the first one is states, now that those who practice justice do so involuntarily, and because they have not the power to be unjust, will best appear if we imagine something of this kind. Having given both to the just and unjust power to do what they will, let us watch and see where their desire will lead them. Then we shall discover in the very act in just and unjust man to be proceeding along the same road, following their interests, which all natures deem to be their good, and are only diverted into the path of justice by the force of law. Here's another little passage from the text as well. No man would keep his hands off of what was not his own, when he could safely take what he liked out of the market, or go into houses and lie with anyone at his pleasure, or kill or release from prison whom he would, and in all respects be like a god among men. Then the actions of the just would be as the actions of the unjust. They would both come at last to the same point. And this we may truly affirm to be a great proof that a man is just not willingly, or because he thinks that justice is any good to him individually, but of necessity. For wherever anyone thinks that he can safely be unjust, there he is unjust. For all men believe in their hearts that injustice is far more profitable to the individual than justice, and he who argues, as I have been supposing, will say that they are right. If you can imagine anyone obtaining this power, becoming invisible and never doing any wrong or touching what was another's, he would be thought by the lookers on to be a most wretched idiot, although they would praise him to one another's faces and keep appearances with one another from a fear that they too might suffer injustice. So personally, in my opinion, this one stands out to me the most. And these sections are really saying that it does not matter if you are just or unjust individual, because at the end of the day, everyone follows the same path that is most beneficial to themselves and no one else, especially if that individual was given enough power to do whatever they wanted. I would say that this is probably a valid assumption for most individuals. However, I do not believe it is valid for everybody. There are many people out there, including myself, whose main focus and mission in life is to help other individuals, which is one of the main reasons why I went into healthcare and why I work in a poverty stricken area. Healthcare can be emotionally, physically, mentally tolling. We work long hours, we see death, we see suffering, we are exposed to all different types of diseases, illnesses every single day we come into work. We work holidays, we work nights, we work weekends, and the list goes on. Taking into consideration those individuals who are missionaries or who routinely go do mission trips. Personally, I've done mission trips to Honduras and Iran, and I'm planning on going to Brazil and Africa in the nearby future. For those who have never done a medical mission trip before, there's not very many parts to it that are beneficial to those individuals who actually go on the mission trips. I barely had enough money for my plane ticket. We lived in tough conditions in the jungle with poisonous snakes and massive insects. I slept on the ground in the rain for about 10 days. We ran out of food and would go from village to village to see patients and treat hundreds of them every day while performing all types of care, even if they weren't in my specialty. Um, and you would do anywhere from medical, dental, physical therapy, and so on and so forth. So, how about the people who feed the homeless? What about the soldiers and first responders who put their life on the line for our country and our society? Everyone has their reasons as to why they go and do acts of courage and kindness. In my opinion, majority of the time, there's not that much benefit to the individual themselves. The reason why I do what I do is because I feel that my purpose in life is to help those in need. By helping others, it truly makes me reflect on my life and what is really important. It makes me extremely thankful for the life that God has given me because without God, I would not have the ability and skill to do what I do every day at work, or have the ability to put a roof over my family's head, or put food on the table every night. In regards to the ring in this passage, I do believe most individuals will perform an act that would benefit themselves more likely than not. But once again, I strongly don't believe that everyone would. I'm a big believer in karma and that bad things happen to people who make bad or wrong decisions. If I acquired the ring and had the power, I would seek acts, decisions that would benefit our country and the world. There is more benefits to helping many people rather than just yourself. I would try to solve starvation, homelessness, healthcare access, etc. And there are so many problems in our society today, and I believe if we could all work together, then we can solve some of these challenging obstacles that affect so many people. I'm positive that many authoritative, powerful figures in our society who possess the ring do hide information and are primarily searching for acts that would most benefit themselves and their company, which is extremely unfortunate. Well, that's it for my presentation. I appreciate you listening. Thank you.